say that the answer is kind of changing. The time is constantly evolving. First, in my native Chile, I'm from Chile. During my 20s, I encountered yoga as a mind-body movement therapy or practice that resonated with me, both physically and emotionally, spiritually, like a one package practice. Later, so I started practicing yoga. I never stopped since then. Later in 2016, I was super lucky. I had this great opportunity to study the mechanisms underlying the potential health benefits of body stretching. And I did this at Dr. Langevan Connective Tissue Lab. So during this postdoctoral time, I realized that I wanted to become what we call a translational researcher, studying the effects of mind-body movement therapies, or MBT for short. This is really long. And I wanted to do that in chronic pain linked to chronic inflammation. That's like maybe, yeah, what motivated me to do this. But there's also a societal standpoint, though, or aspect, which is that I'm very curious about the physiological processes involved in the preventive health benefit of, in general, physical activity or body movement, including MBMT. So to prevent conditions rather than to treat conditions. So that's the other half. I think it has tons of layers, that question. I will give you maybe two perspectives. So the first one is that in our paper, we mentioned two physical activity guidelines, the US and the WHO ones. These guidelines are available there online. Everyone can download them and read them. And they provide a rich set of tips and, graph and figures and tables that help, they can be used to educate the general population about physical activity requirements. For example, they say that for well-being and health, they recommend at least 150 to 300 minutes of moderate intensity physical activity, or the equivalent for vigorous activity. And this is for all adults. For children, is different. That's like maybe the first perspective, but there's another one that I think is more nuanced, in my opinion. I'm gonna wear have to wear my patient hat to answer this. So when we ask about exercise-related guidelines for older adults, we also must maybe wonder about representation in our studies. So how I can say this? So maybe the same recommendation that we think would work in a specific population, it may not work in other populations. So for example, BIPOC older adults, or LGBTQIA+ older adults. This population face challenges that are different. And therefore, maybe the same thing that we are telling to the general population, it must be very hard for someone that, for example, live in a place that doesn't have a lot of green areas, or a place that doesn't have the type of practice that specific individual want to practice. For example, maybe I'm not into running, not into walking, I want to dance, for example. And I was born in a place that there's nothing like that. You know what I mean? So, in other words, that's a similar recommendation work for everyone? No. So it's I don't think so. So we need to keep that in mind. And maybe the last part that I would like to talk about in this question, because it's really good, is that, so I mean, whoever wrote the question says, with another pandemic, right? Yeah, like if we have another like global event. And pandemic is just one example of a global crisis. We also need recommendation for older adults, including this other kind of population, BIPOC and queer populations that face other crises. For example, climate change or forced immigration. So it would be, and you can have the recommendation, but if you're living in a refugee camp, we need to kind of figure out what to do, right? War, right? And that can affect the whole planet. So yeah, pandemic is one, but not the only one. Yeah, but the guidelines at least provide. I don't know if you have seen them, but they have a list of different physical activity modalities. Like running, biking, yoga, tai chi, qigong. These are more mind-body movement therapies. Dancing, which I'm really interested. That people can practice, and they give tables that kind of give you a glimpse of for how long, all these parameters that we never talk about, like duration of the practice, frequency, how many times during the week, what else, intensity, like it's different. Like yoga, for example, is like you can have a very gentle yoga, but then you can also have version of other kind of yogas practices that are really physically demanding,